Hey everyone, it's Carolyn from Nurture Spa. I'm here with Jaclyn Strausser from SkinCeuticals.
Hi guys.
We're so excited to be coming to you live from Nurture Spa in New Hope, Pennsylvania from our CryoCorrect Precision event today. And it's melanoma. May is Melanoma Awareness Month.
It is, yeah. May is Melanoma Awareness Month, so make sure you're getting those spots checked. You should get one every year.
Yeah, it's super important. I do the whole body check every year, and I was surprised at what was showing up, even though I don't have a history of it in my family. Super important to do. Super important to always wear your sunscreen. And what we've been talking about today is after you get your check, you should come in and CryoCorrect. Isn't that funny? Because this device that we're focusing the event around today, it's called the CryoCorrect Precision device. It's an FDA medical device created by SkinCeuticals, many years in the making. We're so excited to have it here at Nurture Spa and at today's event, which you could still come in for. It's not too late. We're going to be offering the treatments all day up until we close. You can zap 3 of your sunspots or little skin tags or any little spots that bother you just for $110. And in a moment here, Jaclyn's actually going to zap a spot on my forehead that's been bugging me forever. But before that, I just wanted Jaclyn to have you take a second and just tell everybody how this thing works and why it's so unique.
Yeah, absolutely. So the CryoCorrect Precision Pen uses CO2 gas to freeze epidermal sun lesions as well as skin tags. So this is a painless experience. It's very quick. A treatment for one spot takes 10 seconds. There's no numbing involved. Again, there's no pain, and it's very cost effective. So it's something that you can add on even when you're in here for your facials or some of your other treatments. It can just be added on very quickly. And you don't run the risk of hypopigmentation and scarring that can come with some other modalities that are out there. And again, just to reiterate, it is Melanoma Awareness Month, so make sure you're all getting your skin checks. So if you haven't yet, get to your dermatologist, get your yearly skin checked, and then come get CryoCorrect. And then of course we are backed by SkinCeuticals, and so we have our antioxidant packages today as well on special. So the CE ferulic and Floritin, which are our 2 best-selling antioxidants, they actually come with a complimentary sunscreen today. And they're available until you run out.
Until we run out,
So not just today, until supplies last. So it's a really great deal. It's a $34 added value because your sunscreen is free. So we really did in our clinical studies, we do the CryoCorrect treatment, but then we want you to follow up subsequently with your antioxidant every day as well as your sunscreen because that's super important.
And it's only once a year that SkinCeuticals offers these wonderful packages. So
that's correct.
Anybody that, even if
Stock up.
I was gonna say, even if you're using it now and you haven't run out, now's a great time to come in and replenish your inventory, your stock of Floritin or CE ferulic. And I've had a couple spots already treated, one on my face and one on my hand, and the results have been fantastic. But we're just going to show you real quick, just because I want you guys to see how it truly is painless, and it literally takes 10 seconds. And as Jaclyn said, you can add it on to any treatment. You can be in here for your pedicure, for your massage. You could just ask at the front desk and say, hey, I just wanted to see if somebody could, do the CryoCorrect on me, and is anybody available? And we could probably do it right then. So.
Yeah, absolutely. So Carolyn has a little area on her forehead that bothers her and drives her crazy. And even though it's very fair and I can, it doesn't bother me, it's something that bothers her, but this pen can treat darker spots or lighter spots. So we're going to go ahead and, we're going to go ahead and treat her. So this would be ideally what would happen in the treatment room. We're going to just wipe the area with alcohol because we want to get rid of any debris, makeup, grease. We want to make sure that area is nice and clear so we can see what we're doing. So that's what I'm doing right now. She's all good.
Jaclyn's a licensed esthetician as well for many years.
Yes.
She has a great touch.
Well, thank you.
You're welcome.
So we're going to take our device. The CO2 is emitted out of this tiny little area right here, and we're going to freeze the area for 5 seconds. So as you can see, the area turns a little bit white. That's called cryonecrosis. It's a death of the skin cell. We want that to happen. We're just going to let this thaw out now, and I'm going to wipe the area clean of any residue. And did that hurt?
No.
She feels
You feel blowing. You feel
fine.
like air blow on you.
Yes.
Yeah.
And then we're going to treat it one more time, making this a 10-second treatment. And she is all done.
Easy peasy.
We're going to put some Floritin on you.
Yeah.
So your vitamin C should be used immediately after and then following up as the days to come along with your sunscreen, of course.
Because the vitamin C actually helps heal, and it doesn't sting, it doesn't burn. It's actually going to speed up the healing process. And for anyone that comes in and gets the CryoCorrect treatment, especially if someone has kind of a larger spot that they're treating, like we just had somebody leave the spa today who was treating something, about the size
of a quarter.
Yeah, on her cheek. It will probably get kind of dark and maybe scab up a little bit, and if that does happen, don't pick it off. You'll want to treat your skin as you normally would, moisturize it, hydrate it, don't exfoliate. If you use retinol or anything like that, leave that area free of retinols or anything more aggressive, any physical scrubs, you don't want to use those.
Yep.
And just let it kind of naturally fall off. And within a couple days to no more than 4 weeks, depending on the size of the area we treated.
Yeah. So 4 to 6 weeks is the full healing time. So we want you to give it that full range of healing. Everybody heals differently. So most people within the first week, that dark spot has already fallen away. Your skin tag will definitely fall off in weeks 2 to 3. Skin tags do not get darker. So keep that in mind. If you are treating skin tags, they just naturally just disappear and fall off. If you are treating a sunspot, it is to be expected that it's going to get darker over the next week or so. It's going to get a little scabby, and it's going to naturally just lift off. We want you to just let that fall off on its own, not to pick it off, because then you run the risk of scarring and prolonged healing time. So during that time, lay off of exfoliants, scrubs, retinols, peels, things like that, but still keep on moisturizing, using your antioxidant from SkinCeuticals as well as an SPF, and you'll be good to go.
Yeah, my personal experience for the 2 little spots that I did a little one on my face here that was gone literally in less than 3 days. I think it was like 2.5. I treated one on my hand, which is taking a little bit longer. It's been over a month, and I'd say it's reduced by probably like 70%, but actually I think I may want to treat this one more time, which can be done. So if you have a spot that's been around a little bit longer or on a different part of your body, I think sometimes hands react differently than face.
Hands are a little bit tougher just because you don't realize how often you're washing your hands, which is a type of exfoliation, so they can be a little bit trickier. Scabs can fall off a little bit prematurely there because of that reason. So
but the difference has been phenomenal. So thank you so much for watching. Hope to see you at Nurture Spa, New Hope, Pennsylvania. Thanks to Jaclyn. Thanks to SkinCeuticals for creating this. And we hope to see you guys soon. Bye.